So I was asked to talk on, but I can't point at it. It's not working. It's okay. Right. Okay. I was asked to talk about genetically modified organisms and try to perhaps address some of the issues that we have in modern society where a lot of people don't like them. It was music to my ears to hear Rich Roberts going on about Greenpeace, because I've had a grudge against Greenpeace for so many years, and it annoys me that they're so well funded. And maybe the scientists ought to start going around door to door, starting up a scientific fighting fund or something like that, where everybody puts $10 in. I would be happy to put my name on that. Maybe with one of these new things that new funding agencies, crowdfunding, there's one called Patreon, which is quite a good one. And it'd be very interesting to get Patreon going for people who want to combat the anti-science, because I'm not exactly a global warming denier. That's like a Holocaust denier. It's a mortal sin. But I do think that a lot of the global warming statements in media just go straight through to the press and get published without any criticism or scientific evaluation. We all know that the whole thing's statistical. When you make it 5 years with nothing happening, and then you'll get 3 years that are bad. And so at the moment I've got other things that I have to be an expert on, so I'm not really paying much attention to global warming. But I can show you a very beautiful picture of my solar panels, which I have, not because I'm a crazy global warming advocate, but because I like the technology of the solar panels. So anyway, I've got a kind of a general talk which explains myself, brings you some of the stories out of the Helicobacter discovery and what I've learned, good lessons that I think I learned in the United States with the US regulators, and maybe if the Chinese government, the Chinese FDA follows the way the US regulators have done it, then I think the future is bright, and it's going to be a science-based, evidence-based outcome. So we won't have to worry too much about these dissenting views. What I was going to say is that the people who the Greenpeace, and they're also the people who are worried about carbon dioxide. They're also the people that are anti-nuclear. So in Australia, you've got this paradoxic group of people, and what it means is that anything that's new is probably bad. That's the underlying premise. And they will just keep quiet about the fact that a lot of the things that they don't want to do are actually conflicting with each other. So let me just go forward now. So I'll talk about examples from my Nobel Prize, and probably I'll be bringing in a few examples from other Nobel Prize winners as well. That's my final slide. Okay. So to the organisers, thank you for inviting me back to Guizhou. I've been here before, maybe 2 or 3 times, and I do a lot of walking, climbing up mountains, going to waterfalls, so that's very beautiful, and I always get some nice photographs of Guizhou. It's obviously one of the best places in the world. GMO fact or fiction. Now, when I tried to research this talk, I said, well, can I find negative facts about genetically modified technologies? And the answer is no. So really, as far as I can tell, most of the negative facts, if I can find any, are probably fiction. And when I read them, I'm always skeptical, or they're meaningless or pointless. And so I think that is fiction. There are lots of positive facts about GM. Rich Roberts mentioned a few, and I'll mention a few as well here. I'll tell you about my background. So here's my life. I was born 1951, died 2081. I'm probably going to live a long, long time. And modern technology, who knows where that number is going to be. So you see Nobel Prize winners live longer. It's a proven fact. However, I'm exaggerating because it's only about 2 years longer than at the moment, but maybe it can get better. Here I am, here's my hometown, Perth, Western Australia, and here you see Western Australia. We say in the zone because Perth is in the same time zone as China, is Perth. 2 million people, good size, most things are there, but lots of space. And people in China should be able to like it because you can have a car, or 2 cars, or 3 cars, and there's no restrictions on that you could buy a car. So even in a lot of places, I'd like to be in Australia just because you feel a bit more freedom, but you need a bit of space there to travel around. Here's the University of Western Australia, and it has the world ranking of times 168, Shanghai Jiaotong of 88 in 2013, so it's usually around about 90, and it's a very strong biomedical sciences college, so it's a good one to look at if you're trying to maybe get some experience overseas. Here's an old photograph of Dr. Warren and me. Dr. Warren, who's 77 now, I think. 1984 when we had our first papers published, and I always make the comment, in those days he was a pathologist, so pathologists get good salary in Australia. I was a research fellow. I had very poorly fitting trousers, as you see, because I always had to buy at Kmart or someplace like that. Okay. Now we're interested in this bacteria, Helicobacter pylori, and I'll just show you how important it is in China. So this is the epidemiology of the different provinces, and you can see that maybe that's Shenzhen or someplace like that. 42% of the population has the bacteria, but in other places, 85% up here in the mountains, 68%. That's a great job, I think. 70% up in places, Urumqi. I can't remember the name of that province. Now, because so many people in China have Helicobacter pylori, so on average about half of the whole population, so many people ultimately get stomach cancer. And the cancer rate rises exponentially in old people past the age of 50. So your parents, if they had H. pylori, they're in their 50s, getting up there, so their cancer rate is now rising exponentially. So by the time they're 60 or 70, the cancer rate may be 60 per 100,000 per year, 70, 100 per 100,000 per year as they get older. So if they are well, it's going to be a great sadness for the family if someone who's otherwise elderly but perfectly well then gets stomach cancer. Almost half the cases of stomach cancer in the world occur in China, 350,000 cases per year. So that's the main reason why I come to China, and I come about 4 times a year with talking about some Marshall Center, special centers of excellence for Helicobacter, because we think things happen quickly in China, and maybe 10 or 20 years from now, most of those people will be fine without H. pylori. My science career has always been in research, but also in translation, and it's really good if you can make a research discovery and then benefit people in some way with a practical use. So my history is that I started doing that kind of thing when I was in high school, so that's me doing I came second in the science competition at my school. Here's a couple of the judges who are looking at me. So I won the prize because I could tell them all about thermodynamics and why refrigerators work, entropy, things like that. So they were impressed by that, but they were also impressed in the translation because it was very hot, no air conditioning in my school. And I had a lot of ice creams inside my little refrigerator, which I was giving to the judges. So they say, this is discovery, theory, and translation. So we like that. So I think that's the situation we are also in medicine. We have a lot of problems we're trying to solve in medicine. So it's good to have the opportunity of being a clinician and connecting also down into the research lab, or being in the research lab but having a good colleague who's somewhere in the hospital who's saying, we've got this problem, we've got that problem. And the big problem that we addressed this morning was precision medicine or lack of it, but the technology's coming in and that's going to help a lot. So my science career after discovering the Helicobacter, we said it's too complicated, we want some easy ways of diagnosing it. So this is a biopsy test, the Helicobacter. If you put the biopsy in here and it goes red in about 10 minutes, that means it's making ammonia, must be H. pylori. And that meant that all of a sudden, every gastroenterologist could make a diagnosis, didn't need a fancy research lab anymore. And the other one that you know about is breath test for Helicobacter. Here's somebody doing a breath test where you measure an isotope in the breath, and that means that every doctor, every family doctor probably in China has access to the breath test. Dr. Warren's initial observation, you see he had these bacteria seen on the biopsy samples. Now he looks at biopsies because he's trying to see if the patient has cancer. So a tiny little sample from the stomach is sent to Dr. Warren, he looks in there, and he started seeing these bacteria. And he said, well, these bacteria, see how they stick around the edges of the cells, and they all look the same. They're all the same shape, they're slightly flattened out S-shapes, spiral bacteria, curved bacteria. He said it's not possible that these bacteria are contamination from the mouth, they must be growing in the stomach. And he was talking to me about it, and I said, well, that is very interesting, because all the medical books say bacteria cannot live in the stomach, too much acid. So therefore, everybody who believes the medical books and doesn't think says, these must be therefore contaminated, irrelevant, just a coincidence. And so nobody else was interested in it, but I was interested because maybe you're the same. You get satisfaction by proving that everybody else is wrong. So, if you guys all say one thing, I will immediately say the opposite. I'll start from there and then try to, maybe I'll move across. So my wife says that to me. She says, whatever I say, you say the opposite. And I say, no, I don't. You see the joke there? So in some ways it's good to be like that. So I set out to do this question, how can bacteria survive in the human stomach and resist acid? So that was my interesting reason for doing the research. And I then worked out that the urease enzyme of H. pylori is the reason it can resist acid. So here's urea, carbon dioxide and 2 ammonias. And when you break down urea, so urea is present in all the body fluids, the stomach, the saliva, the urine, everything. But when you break down urea, it consumes an acid, a hydrogen ion, and on this side generates ammonium bicarbonate. So that's a perfect way for bacteria to survive in the acid environment of the stomach, because there's urea just coming down in your saliva all the time. Now, the skeptics would say that people with these stomach bacteria, they're people who have ulcers already. Ulcer is the primary event. Then the harmless commensal bacteria colonise the patient with an ulcer. And the bacteria are irrelevant because ulcers come and go, the bacteria remain. So that would be one argument, in which case you would just ignore the bacteria and carry on. But of course the other argument would be the bacteria is the initial event which infects a healthy person. The stomach becomes defective and then acid can break through where the bacteria are infecting the stomach and cause ulcers. And ulcers heal if acid is blocked. But of course they will return if the bacteria are not eradicated. So this we now know is the true side of things, which eventually was accepted after only about 15 years. So initially Dr. Warren and I, we studied the patients at Royal Perth Hospital, and here you see they had an endoscopy, so this is the endoscopic appearance down here. Number of patients, the number that had bacteria, and p-values. So you see the total patients are 100, and we had the 58 patients who had the bacteria, and that's 58%. And someone said to me, Dr. Marshall, why do you always have 100 patients in your research? And I said, well, that is because I didn't have a computer, so I want to work out the statistics very quickly and not make any mistakes. So I always stop when I got 100, and then I could have the 58%, as so it goes. But when we looked at the patients who had a duodenal ulcer, 13 patients, all 13 had the bacteria 100%. And I worked it out of my Hewlett-Packard emulator last night, and if you multiply 0.58 if you had take 0.58 to the 13th power, you end up with a number 0.0008. But this is a two-tailed test here, so it's 0.0044. So that's highly significant. And one of the interesting things is if people don't, in their hearts, believe something, when you show them a p-value like this, it makes no difference. You haven't convinced them. They think it must be a mistake or you had an artifact in your data. The other thing that makes people think this is an artifact is because it's 100%. And in every biological system, you never get 100%. If ever you see any paper with 100% or something, you are very suspicious immediately that there's some artifact that's been introduced and nothing is really going to be like that. So that made it difficult for us to convince people that these bacteria are harmful. So would the world accept a new cause for ulcers on the basis from data from only 13 patients? Now the interesting thing to know for an economist is at this time already in 1982, Glaxo and SmithKline and French, some of the largest pharmaceutical companies, were making $2 billion per year treating ulcers with acid-lowering drugs. So you said when you eat, this is like somebody who's, maybe they're trying to be impartial, but they're really advocates for their treatment. And they don't want to see a cure because pharmaceutical companies make their money from treatments. They don't want to cure you because that's only one treatment or one day or 1 week. They want to treat you and give you a treatment every day for the rest of your life. And so that is why the pharmaceutical industry is propped up by treatments for, I guess, acid blockers, they're very common, high blood pressure, cholesterol, diabetes, chronic rheumatoid arthritis, so chronic diseases with drugs that are treatments that you have to keep taking because they are no longer doing, once they have the drug, they're not doing any research on how to cure the disease because that would make their drug worthless. They're doing research on how to give the same drug for other things in different ways. Okay, so not going to happen. So here's Dr. Warren and I, and we were very confident after about a year of research, we became very confident that we had discovered the cause of ulcers and that these bacteria were important. One of the reasons was that we found that other people had seen these bacteria before and published them in the literature, but had been ignored because of this dogma that the bacteria could not live in the stomach. So people wouldn't even believe those other publications. So one of them was from China, and this is Dr. Yao Shi, and he found that these bacteria were present in the stomach, and he used the occurred bacteria in his thesis. Professor Xiao Shidong from Shanghai died last year, but he was his PhD supervisor, I think. So people around the world had seen these bacteria. Actually, in China, there were people who treated ulcers with antibiotics because they thought maybe it was an infection. They didn't really know much about it. They were just guessing. So our paper was not accepted for presentation when we submitted it to the local meeting. They said 67 were submitted, we could only accept 56. So that means my paper, which I submitted to a local meeting, was in the bottom 20%. So we're very disappointed about that. It was the people who were running the conference, they said it's such a bad one. They said you can't even have a poster. So when you're not even allowed to get a poster, they said, by the way, please don't come. So of course we were very disappointed, but I don't think I have the slide of it, but in the Chinese folklore is that story about King Koujian from Shaoxing, and he has this story called Washing Changdan, which means sleeping on brushwood and tasting fire. And the story was that he had to have a lot of suffering when he was captured by the enemies. And after about 10 years, they let him go again. He went back home. But every night, he didn't live in luxury. He was just sleeping on sticks, tasting the bile, to remind him of his humiliation And after 10 years, he raised an army. He went back up to those people, Iwushi, I think, or Nanjing, that area, and killed everybody. And so then that's his revenge. So this is a good story for students, and it's a good story for me too, because I knew that all those doctors who rejected my paper, I said one day they're going to be out of a job, because I'm going to be treating ulcers with antibiotics, and they don't need to do expensive procedures anymore. So sadly, that is still going to happen. There's a lot of doctors in China who make money doing upper endoscopies. 10 years from now, they won't be able to find enough patients to make a living. So their punishment is they have to do lower endoscopies, not so glamorous. So, we'll move on. Anyway, how do you prove bacteria are harmful? Robert Koch cultured bacteria in 1882, the TB bacteria, and everyone said, that's so common, it's not possible that these bacteria could cause fatal diseases like tuberculosis. So he infected guinea pigs, and he said to prove bacteria are harmful, infect into an experimental animal, which is guinea pigs. And then he said if TB develops in the animal, it's proven the bacteria are harmful. So he did that experiment, and he wrote it up, and he said this is called Koch's postulate. So this is what you have to do to prove a bacteria is harmful. Well, that was all very well, but we didn't have any animals we could infect with H. pylori because it's just a human bacteria. And so I did this self-experiment, which is described here. And here's a comic of me. I think I was 31 years old in those days. 32. I'm very reckless. And so I'm going to drink the bacteria. Now this comic has got an interesting story because it was done by a pharmaceutical company in the US after the FDA accepted the discovery. And they asked the comic strip artist to come and do an interview with me, and then he produced a comic about the discovery of H. pylori, the self-experiment and everything. So this is one page from it. And if you go to Sweden, you can go to the Nobel Prize Museum, and you can see the full comic there. Maybe read it. Maybe if you send me an email, I'll send you an online copy. Because it's very rare now. Anyway, so I'm saying there's no other way, and I thought maybe after a few years I might get an ulcer. Because most people with a Helicobacter, they didn't have any symptoms, they feel fine. So I'm sure there are people in this room who have it, who never have any kind of trouble. But maybe it's going to cause damage over the years. Anyway, so I was surprised that after I drank the bacteria, after about 3 days or 4 days, I started vomiting. And I was vomiting for about 5 days. So these bacteria, it seems, can cause an inflammation or something in the stomach. So Dr. Warren and I arranged the endoscopy there, and he's looking in, Dr. Marshall, your stomach is inflamed, and that means the stomach looks a bit red. And here we are on day 10, and you see all these bacteria in my stomach as well, exactly like patients with ulcers or gastritis. So we proved that a healthy person can be infected with a Helicobacter. So Helicobacter is the cause of gastritis. This is a disease affecting more than half of all humans. So it turns out we had discovered the most common disease in the world. And this was our first paper. So it was kind of a lucky discovery, but we were very persistent. We moved on. So here again is research and translation. I told you a bit about it. So to make it easy for the gastroenterologists and myself, I invented this test called a urease test, quite an accurate test, the Helicobacter, and then a couple of years later, a breath test. So the reason I brought this up is because the breath test I invented initially, I had a patent which covered all kinds of isotopes, carbon-13, carbon-14. But I realised that the carbon-14 was less expensive and had less expensive technology, so I promoted the carbon-14 breath test as the main one, and started doing research on that kind of breath test. As a result of my work, there are about 30 million tests or more of the biopsy tests are done per year, at least 10 million a year in China, and breath tests 30 million tests per year, and the Headway company in Shenzhen makes it mostly, and this is the carbon-14 breath test, at least 10 million in China. Several competitors now. So benefiting mankind is the translation so that everybody can use this new technology. That's why you win a Nobel. So I've got a picture there of me and Dr. Warren winning the Nobel Prize. That was a very interesting night. So let me just talk about the FDA in the United States and the urea breath test. Now, it's scientifically, it should be safe because you can actually know about physics and you can make calculations. But there's a lot of people who are very paranoid about radiotherapy. Not radiotherapy, but radioisotopes, radioactivity. And they don't realise that things like carbon-14, it's a naturally occurring isotope used here as a tracer. So you've got it in your body, it's in your food, it's everywhere. This amount for our breath test is very low dose. So it's less than going in a plane or living in Colorado for one day. There's all kinds of reasons why we know it must be safe, and we can measure it, and you can measure people getting the same effect from other kinds of radiation and nothing happens. This is very similar to background, and we can also measure that when you do the breath test, we can measure the urine over 24 hours. Guess what happens? All the C14 comes out in the urine in 24 hours, and the other part comes out in your breath. So after 24 hours, there's hardly any of it left in your body anyway. So in the United States, we obviously, with this kind of information, you have to be very firm about your facts. You have to do the research. You have to find the references, proving all these things. And there was a lot of information about carbon-14. And we had to have confidence in the regulator because, okay, we're going to raise $10 million now and do some trials for the breath test and get it approved by the FDA. So I have to say to the investors, we're going to raise that $10 million, but don't worry, here's all the data we have, we're giving it to the FDA, and we trust them, they are scientists, they will approve it. So this is what we hope is going to happen with GMO, and in fact this is what happens with GMO in the United States. When they have enough data and present it to the Food and Drug, usually, or eventually, this product is going to be released on the market and it won't have any safety, it won't have any dangers written on the label. So we eventually did get approval. It was quite difficult. The FDA don't usually accept your data first time around. If you do 100 patients, they'll say you have to have 200. If you have 1,000, they'll say you have to have 2,000. So you always have a lot of financial strain when you talk to the FDA, but they are good scientists, and you can rely that if you have the data, then you'll get the approval. And people say to me in Australia, or people I've met around the world, say, Dr. Marshall, you're a Nobel Prize winner. How can you help me? Can you write a letter for me promoting my product to the FDA saying it's really good? And they should trust it. And I say, look, the only thing that's going to help the FDA accept your product is data. You get data. If it's scientifically good data and statistically correct, collected the same way, the FDA will like it. They will like you. And they will approve it after a few more months. And so that is the case. And I know that there was a problem with the FDA in China. And sadly, someone received a death penalty from that because there were bribes going to the FDA. But as soon as that happens, all of a sudden everybody doesn't really understand what is the true pathway for a new product. But if the true pathway is going to be science and good and data, that means the scientists are going to have jobs, the statisticians will have jobs, and the investors will trust everybody and put money into this new products, which will be approved. And then someone in another country is going to say, it's approved in China. We don't have to repeat that. We will just use the Chinese product and use their data and translate the Chinese application into English or something like that. So that's currently, at the moment, the FDA in the United States is the gold standard. And a lot of other people, it helps a lot of countries because after they've done all that work, then it can be approved in another country. And we always worry, you always hear statistics about how costly health is in the United States, maybe 14% of GDP. But there are thousands, hundreds of thousands of jobs in the health business in the United States that don't exist in other countries, because the FDA has thousands of consultants that they are sending out these applications and reviews, and it's a good living for a lot of people. So there's industries in the United States related to health that we are paying for because we're buying products and licensing products back from the USA. So just remember that. So a little bit of knowledge that we showed the FDA. We said, okay, here's carbon-14, nitrogen gets hit by a cosmic ray, turns into carbon-14, it's a little bit heavier. It's CO2, it goes into trees, the animals eat the trees, and then we eat the meat. So everybody is going to have carbon-14 in their body. And it's going to be related to how old you are, and things like that. And so it starts off at this level, and then when you die, it gradually decays over 5,000 years. And so you can do accurate dating on fossils down to about 40 or 50,000 years nowadays. Used to do scintillation counting, look at radioactivity, but now you can do mass spec on carbon-14 to get very, very accurate dating out to 50,000 years if you have fossils. I'll just tell you, I'm interested in anthropology, but the most beautiful fossil is a tooth, and you use tooth carbonate. That's the hardest. If you can do carbon dating on tooth carbonate of a fossil human, there's no argument. It's got carbon-14 in it, must be less than 50,000 years, and you can get an accurate date on it. Nobody can argue with you. Other kinds of dating are less accurate. One of the things we told the FDA was that people had reported this carbon in DNA can change back to nitrogen. And so this is a base. I can't remember which one. This might be adenine and going to cytosine, but effectively one of the carbon atoms randomly turns into a nitrogen and opens up the base, and then you get a different base then in your DNA, and potentially a mutation or breaking DNA could happen. We showed data to the FDA saying that this is so rare, and in fact you have so many enzymes in your body to repair DNA, that this has never been measurable. You've never been able to show birth defects in worms, insects, or any other animal because of carbon-14, because to get something to happen, you have to give so much carbon-14 it kills the animal before he can reproduce. And so that means that's why we don't have too much worry from carbon-14, and there's a lot of data out there. So we showed that data to the FDA, and they said, well, that's physics, you can't argue with that, that's real. You don't have to discover that again, Dr. Marshall. There are hundreds of people who've written about that. So after the data on safety was collected and submitted, it was approved without restriction. In fact, we had so much data, they said they had never seen so much data about radioactive drugs in humans, and they said no restriction, women, children, pregnant women, babies, anybody can have it, because you already have it in your body anyway, so how could it possibly be a problem? So it's continued now as a UBT, totally approved in the United States for 20 years and in many, many countries. No side effects. So this is what we want. We want to expect the same stringent process with the regulation of GM products. We don't want to say, have the FDA take our word for it. We want to say, here, we gave this GM product to 1,000 rats who had 3 generations over 12 months or 2 years, and look, same as controls. That kind of data. And so there's all kinds of data that you might do, even cell-based in vitro experiments these days. But there's no physical reason why a GM product should be harmful. Nobody can actually figure out a mechanism why it might be harmful. And this idea of DNA swapping and changing and having mutations in it is something that's been happening in nature for millions and billions of years probably. That's called evolution. Every single person in this room was born with up to between 100 and 300 lethal mutations in their genome. So most of the time you don't know about it if you're unlucky and accidentally married somebody who was your close relative. So you came from an orphanage, that could happen. not so many these days, but that kind of thing could lead to two people with a serious mutation and a homozygous offspring, and that used to happen to the royal family in Europe. Queen Victoria's children used to get haemophilia. So that was because that was a sex-linked thing related to, I might be talking wrong, but those kinds of things can happen. There's also a lot of those kind of hereditary mutations in places like Turkey, in little villages miles away from civilization where everyone, 100 people live in that village for 6 or 7 generations. And also with the Amish people who live in Pennsylvania, there was only 100 or so, 200 people came and colonised that part of Lancaster County in Pennsylvania. Now there's 20,000 people, so they're all related to each other. And they all do genetic screening now to make sure that they're not going to be transmitting genetic weaknesses to their offspring. So with any biologic product, so this is the kind of thing which the regulators do for drugs, radioactive materials, cell-based products, GM products, food products, anything. They have to do this. If you've changed it in any way, then it's a new product. So the data has to be validated and reproducible. So this, we talked about this today, people publishing data. And one of the big sins in experiments when a master's student has only got 6 months to finish his work, starts working away, getting some data, all of a sudden runs the data, p-value 0.045. Aha, it's proven. Stop the experiment, write the paper. And so then you might get a publication. So just remember, it has to be reproducible. And then the safety of a new product can be assessed. So the FDA says, okay, you do your study, and then they look at it and say, okay, now do it again in that country. Or now do it again in California. Some other population, they'll make you do that. So then you take your original data and you apply that data set to the new data and see if it's the same. And then you can really get some robust data. So you'll always see at least 2 studies in the United States. So then after a favourable ruling, the product can be sold and a new business develops. So in the US recently they approved some kind of giant, quickly growing salmon. So they put a gene in that salmon and there was all kinds of safety things that happened, but basically these salmon grow quickly and they taste just as good. So that seems to be useful. Persons who benefit from the product can then make a choice to use it or not to use it. Now this is where there's controversy, and Rich Roberts was talking about this, labelling. So because there is nothing wrong with a GM product, the only way the competition, which is the Whole Foods, the natural foods people, the only thing they can try and do, because their technology is no technology, it's more expensive, not as good. So the only thing that they can try and do is raise the price of the GM up. So it's the same, and then when you see 2 products, this one's the same as that one, both expensive, maybe you would choose the organic, right? But if the GM product looks really nice and is half the price or 30% cheaper, you say, well, I don't love organic so much, I'm taking the GM one. So what they're trying to do is create labeling barriers for the GMs. So they'll say, even if it's proven to be totally harmless, you've got to have GM, danger. And then the other people, they say, green, no GM. And they'll have pictures of flowers, it'll be green, there'll be little girls and flowers and things like that. So that's the marketing strategy, it's just a marketing strategy. Now the other issue that they will do is they'll say, you'll say, I got this beautiful new GM corn, and no worms in it, great. And the labelling people say, you can't put that GM corn in this train and take it to Bangladesh because you'll contaminate the train. We'll never be able to put the organic corn in it. So you have to have your own special train for the GM. And now it costs twice as much to move it. You've got to have these silos, only GM. You've got to have some kind of ship, only GM, or only organic. So if they can do that, they raise the transport cost and they're decreasing the value and decreasing the benefit of the GM. So be very wary of these labelling things. So the final thing about that is you might say, okay, well look, here's the deal. Well, you could say it's GM if it's got more than 0.1% GM product in it. But they'll get some new technology which can find 0.0000, like 1 pollen grain in a truckload. They'll say, contaminated with GM. So this is the issue. Our technology means that we can find Roundup in baby formula, probably, in our hair. All these things are all over in the environment in tiny, tiny amounts. And the technology is such now that you can always find it if you have some new technology that looks for it. So this is why the GM and the people who don't like new products are trying to get the regulators very active. And some of it's related to out-of-date legislation in the United States. And I don't know, hands up to anybody who's been to California. Anybody? In California, there is a rule that if anything is the slightest bit carcinogenic, so say you get a rat and every day you feed him 10 grams of sweetener. You rub it all over his body and dip him in it every day, and after 5 years this rat gets a skin cancer. Sweetener causes skin cancer. So then every time anybody uses sweetener in California, there'll be this sign. This product has been shown to cause some cancer in some kind of models. And when you go into a shop in California, there's always a sign on the door. Some products in this shop contain agents which have been proven in the state of California to cause cancer. You say, well, it's just a shoe shop, isn't it? Oh yeah, but smell that leather? That can cause cancer. And that shows some data. If you feed leather to rats for 5 years, they'll get stomach cancer or something. So what it means is that that's the other sort of information. If you just raise the level of noise so much, now everybody assumes that everything causes cancer in California and just ignores that because those messages mean nothing nowadays. So that's a stupid situation. But people might want to use it or not use it. So you can say, okay, if you want to put a label on your product and say it's organic, it can be that. It just has to have less than 0.1% GM in it. That's pretty easy, and you can label it organic. Great. But it's dishonest to put no GM. These kinds of warning labels on it. Because you're just trying to raise the cost of the GM product and make it more expensive and wasteful. So any new technology, you do this cost-benefit analysis. And so this is a strategy for ulcer treatment. So here's the cost, here's the benefit, here's the new treatment, and here's the old treatment. So the new treatment, kill Helicobacter with antibiotics, that costs $200, including diagnosis. The old treatment, take medicine every day for the rest of your life, or have surgery. That's $10,000. So this one's $50, 50 times more. So you say, okay, probably this is a good choice here. But what about the benefit? Okay, this one is better, takes 2 weeks, and it cures 80% of people with ulcers. Totally cures them. This one is probably, the drugs are not much different really, but the cure rate after a treatment of a few months is only 20%. So 80% of people get their ulcers back. So you can see when you look at this matrix for our new ulcer treatment, you say, okay, this is obviously going to be the new one. When you've got that kind of differential, you don't have to worry very much. If you've got your facts right and the data is right, you don't really have to worry about the opposition or the competitor. This is going to be the one that wins because ultimately it's going to be more cost effective and people are smart enough to tell this is going to be good. So the FDA will approve this one. This one will stay on the market for a few years because they only have to treat one patient to make some money. You have to treat 50 to make the same amount of money. So they've got a lot of marketing power. That's going to distort the market for a long time. That's probably what happened with our discovery. Okay, so let's go to GM products. News, GM, old technology. I'm not sure what old technology, chemical sprays, weed kill or something like that. So the GM, it's same or less convenient. Not sure, probably not much different. Old technology, same. It might be more difficult. Maybe you have to pull out a lot of weeds or snip off the infected leaves on your banana plants, that kind of thing. And the benefit here is that this new GM product's got some new features. It's stronger, more robust, it might be bigger, and it's resistant to some kind of diseases. So that actually looks good. The old technology, especially in food, a lot of wastage, spoilage, and pests. So this is 40% of the food in the United States is thrown in the rubbish bin. And of course, if you're a street person, if you don't have any income in the United States, but you can find some rubbish bins, you can live and have perfectly good nutrition because there's so much good stuff in those bins. So just remember, this is the kind of strategy that's going to tell you whether your new technology should be approved. And it's not scientific to be worrying about, oh, it might create some kind of magic spell and make you get unwell or kill butterflies or something. You can easily work that out with a bit of science. So finally, I'm going to tell you some cases of this, GM under the radar. So even all the people who hate GM, they're already taking it. And they don't know and they don't want to do the research. So here's a few things. The first GM products were actually medical drug products. Now, these here's the three important ones: insulin, growth hormone, erythropoietin. More recently, vaccines, pretty complicated, rotavirus vaccines. And then the one that's been around for 20 years at least is chymosin in cheese. So it turns out that nearly every bit of cheese in the United States is actually produced using an enzyme out of a genetically modified bacteria, because cow stomach enzyme has become quite expensive. And although in Chengdu, a lot of people like eating stomachs and things like that, in America we're not so happy about stomachs, and we would rather have a GM product than some kind of thing scraped out of the stomach. Anyway, so that was the incentive to make that product. So here's an example, diabetics taking bovine insulin. Now I put this one there because I was doing my internship as a medical doctor in 1975. That's right when this revolution, the first genetically modified organisms with E. coli, and this was the startup from this little company, the little biotech called Genentech. Guess what? It's now one of the biggest drug companies in the world. But Genentech tried to make insulin because with a diabetic taking bovine insulin, antibodies develop, insulin becomes ineffective. So we've got to use more and more. So change to some other kind of insulin. Oh, we use pork insulin. Okay, now the dose is lower again, everybody's happy. But a year later, again, getting antibodies to pork. So what do you do then? So it was a dilemma, and a lot of people on insulin were getting like 150 units twice a day, when usually the dose is 12 units. So people were becoming immune to it. So then the solution was human recombinant insulin, called Humulin, introduced about 1982. And now there are millions of diabetics taking Humulin. And I'll bet you there are millions of diabetics who hate GM, but don't realise that they are injecting it into their body every day. So GM medicine, how safe is it? Well, GM food is eaten and digested, so that it's something else by the time it gets into your body, really. But GM hormones are injected straight into the bloodstream, and the GM product is unmodified, but it still appears very safe after 35 years, so at least there, GM dangers really look like fiction. Because that is a good example of something where nothing happens, just good stuff. Human growth hormone, children with short stature. And so, there's somebody in my family who's got short stature, but we couldn't treat that child when he was a child because, guess what? Human growth hormone was derived from human cadavers, pituitaries. Sometimes an infection is present like Creutzfeldt-Jakob disease, that's like mad cow disease. So when that happened, they couldn't use the normal supply, they had to have something else. So recombinant GM human growth hormone is now available, it's been available since about 1982, directly injected daily, no side effects after 35 years, millions benefit. So the same thing, it's just like insulin, perfectly good. And so children with resistance to growth hormone can easily get that one. It's a good product, making a lot of money for some drug companies. This is an example of the Creutzfeldt-Jakob disease. There's different versions, but this is the one in children. And you see sort of 1985, 90, 95. And so after they stopped using those other products and introduced the new sort, it disappeared by about 70%. So there's still sporadic cases. And guess what? Human growth hormone, celebrities like it. Who are the celebrities? Which drugs is Lance Armstrong accused of taking? He takes everyone. He loves GM. He takes GM growth hormone. He takes GM erythropoietin. And he wins the Tour de France 7 times in a row. So it's definitely good. It makes you strong and healthy. Who else? Well, here's another famous one. Sylvester Stallone charged with taking banned hormone into Australia. So he visited Australia on a movie tour. And in Australia, they really like to go through your luggage, especially if they think you might be carrying some food or something, or if you're a celebrity. And so we always get these kinds of interesting headlines. Celebrity Stallone says, "I'm sorry, my doctor gave it to me," it's that kind of stuff. But he's just taking growth hormone and steroids, everything like that. And there was another great case, a celebrity who was smuggling his girlfriend's dogs into Australia. A country which has no rabies does not want to have anyone else's dogs coming in without quarantine. So that was another one reason. That's a different lecture. Okay, so finally let's look here. The company in the United States, Chipotle, they said, our food's totally organic, come here. But of course, half of the products in that restaurant were made out of cheese, which has this genetically modified yeast in it to make it work. Here it is, chymosin. Bovine chymosin is now produced recombinantly in E. coli and Aspergillus niger and K. lactis. So you can just buy it in a bottle, you just tip it into your milk, stir it up, next morning it's starting to turn into cheese. Very, very good way of making cheese. Rotavirus vaccine, it kills 1 to 2 million children a year around the world. But bovine rotavirus, did I say rotavirus vaccine? I meant rotavirus diarrhea kills infants. Bovine rotavirus is mild in humans. So if you got rotavirus from a cow, you're like, I feel a little bit uncomfortable for one day. It's really very, very mild. Nothing happens. So you take the bovine rotavirus backbone, which gives you this mild problem, and you add all kinds of genes to it from the human rotavirus strains, and you make it. So that's bovine rotavirus, which has been on the market since 2004 by Merck. This is just a picture that you can find on the internet. There's different ones, and they get all these ones, and they put the bovine one underneath it, etc. There's a second one where all the antigens are cloned into it. So that's been approved by the FDA for nearly 15 years. So finally, let me talk about this other interesting one called Ty21. This was the first live bacterial vaccine for typhoid. I've got a feeling that I'm not using the new set of slides that you gave them, Garrett. You reckon? Because I changed the slide. Maybe I've got it still there. Anyway, so this typhoid, attenuated typhoid that we use as a vaccine, I have taken it, and it's just a little packet. You just swallow 3 pills before you go down to Brazil or someplace like that. And this vaccine is attenuated with carcinogenic mutagens. So you get the world's worst possible carcinogens. They mix them up with the typhoid bacteria, and then they clone out all kinds of bacteria, give them to mice. Eventually they find one that doesn't kill the mice, but creates antibodies. So that's the type 21 vaccine that was produced in the early 80s. So this vaccine has got hundreds of semi-lethal mutations. They've done its full genome now. It's got more than 300 mutations in it. So this is like genetically modified extremely. This has now been given to millions of people and it's been safe for 40 years. Guess what? It's not called a GMO. It's not genetically engineered. It's just like, just random. Carcinogens or UV light. And I ask you, really, it's got so many things different. And they don't even know what they are. So it's definitely different from the GM. So here's a little bit of a picture of it. So if you go to Africa or somewhere, you might take this World Health Organization, gives it to you. You buy it in your travel shop. So in summary, the safety of GM technology is fact. Fear of GM dangers is wise. So, okay, I just want to know more about these things. Let me just look on the internet, see what this is in their application to the FDA. How many people took it? But actual GM dangers are fiction. Careful and scientifically minded regulators. So it's very important that the FDA in China is incorruptible. So I come along to the FDA, I've got my little Chinese company, we're saying, please approve our product, it's really nice. They say, how many patients? We say, in China, in America we say 100. In China we say 1,000. The FDA looks at our data and says, go away and get 10,000 more. Then we might believe you. We say, please, we'll go bankrupt. We haven't got any money. All our investors are penniless. Their children are starving. Chinese FDA says, too bad. Come back when you've got 10,000. You say, oh, but my brother knows your brother. He's his good friend. And he'll let you park in his garage. That's like worth $10,000 a year or something. FDA guy says, one more word and you go to jail. You're trying to bribe me through my brother's parking garage or something. So that kind of thing happens in China. This is called Guangxi, right? That's the problem. People in the FDA have to be really mean, no friends. The only thing that can happen is that they get promoted. And one day they might be the boss of the FDA, big salary, all that kind of stuff. So this is what it's like in the United States. I can tell you, people in the FDA mostly, they've got something wrong with their personality. Smiling makes no difference. So careful and scientifically minded regulators, they have to be scientists, they have to like data. Steady but consistent advances. So each time you come in, they say, you did 10,000, now do 1,000 more of those minority people in Guizhou. Because those Bouillon people, they drink a lot of beer and Maltais and stuff like that, could be different. So they might ask you to do that, so you would go and do that. Steady but consistent advances and the benefits for all, because not only do you get your new product, but you also get your investors and your investments, and things move forward, and everybody will be very happy. Thank you. Did I go for 40 minutes? Probably longer. What's the time? 5:23. Time to go. Any questions?
Thank you very much. I do have to say the fact that you took that stuff for the when you went to Brazil, I wasn't impressed. You're the guy who drank the bacteria, so that didn't, But no, my question is the following. You raised several times during your talk the conflict between drug companies wanting not to cure but just treat for economic reasons, and the cure. And is that really, at first, is that really still a problem? If it is, it seems to me there's a potential solution, which would be, think of it this way. If you can cure me, and I'm 30 years old or 35, that means I have another 35 or 45 years of a good life because of that. I pay an awful lot for that over treatment every year. The only issue is how would you finance it? And that's something that finance can give to you is we can create a way to finance that so that the economics to the drug company would create an incentive for them to create cures because they would be economically rewarded with a superior solution.
So people have, partly as a result of the Helicobacter and the ulcer situation, a lot of thought went into how the drug companies innovate. And so it was kind of recognised that once the drug has been approved, then they are just collecting safety data and marketing the product. And so the original scientific team moves on. They go somewhere else. Or maybe they just run the quality control lab or whatever. So there's no more innovation on that product. In fact, it's so expensive to bring the product to market. If you change it, if it changes in a tiny way, the FDA will say, it's different. Please do all that clinical research all over again. So it cannot be changed or improved at that point. So when the drug comes to market, it's always 5 years old. And so that's an advantage. The competitor knows that. He might say, well, another 5 years we're going to have a better drug because we are still innovating and we haven't spent that money yet. So that's one thing to remember. The second thing that drug companies have done is they recognise that if you are looking at their company, Warren Buffett is looking at the company, you say, the shares are a bit low, shall I buy or not? What should they be? What's their true value? He looks into the pipeline and he says, what have they got coming through in 2 years, 4 years, 5 years? What's the, precision medicine, they are getting some patents or something's happening there. Okay, pipeline is good. So the pharmaceutical companies have to create this pipeline and they nurture it. It's like a plant. Now, how do they get that pipeline? Well, what they've been doing is putting investment money into a friendly venture capital firm. So the VC firm in Illinois, maybe it's got money from the government, and then it might have money from Pfizer. And it's their job now to try and get value, and then when they have a new product, they will sell it to Pfizer to put on their pipeline. So in fact, it's financial. Obviously, you have to have smart people in Pfizer to pick out which VC has got a product that they would want to buy, so that there's something that starts off as a maybe $20 million, $30 million might happen. And I'm actually involved with a vaccine allergy product that might end up costing, who knows, a lot of money as far as I'm concerned, maybe $30 million. But if Pfizer bought the company in 5 years' time as it was coming towards market, it would be a $200 million company, and all investors would be pretty happy, and there'd probably be some royalty or something like that. But Pfizer would wait until the risk has gone out of it. At the moment, there's this much risk. So as the years go by, the risk goes down until it's quite low. Pfizer said, okay, now it's worth $200 million. So the pharmaceutical companies have strategically put investment into venture capitals, and they've got people looking for the new products for their pipeline. They don't create a new lab of immunology just to work on my product. And they probably put, I know Novartis, they're saying, well, each year we might put 2 or 3 new products into our venture capital pipeline. But don't be disappointed, it's usually full, but we would throw out a couple. This didn't work, that didn't work, it's too expensive. So some of them are going in, staying in the Pfizer fold, if you like, and they're getting kicked out after a couple of years and new ones are coming in. So that's really how it works. So I don't know the better way of doing it personally. The better way of doing it is to have a good angel investor who's got limitless amount of money, much better. Because people in venture capital funds in the United States, in biotech, they're always scientists from failed biotechs. And so they're really mean. But that's probably what you have to be.
Probably for later, but I was thinking of not how you finance drug discovery, but rather you said the drug company doesn't want a cure because they only get a one-time payment. But suppose the one-time payment was $1 million.
Okay, yeah.
But then you say, how do I pay $1 million? I'm an ordinary person. My answer is, if I can finance it just like a house or a car, and I'll pay you the $1 million over the next 35 years, which I can do because you cured me, that's a way to align.
So I've got another lecture which I have given. Okay. It's called "What's a Human Life Worth?" Or should we have seatbelts on buses? And you've probably seen these discussions. And it's the thing is, how do you work out the value of a human life? Because if you divide that by 50 years or 60 years in an adult, you say, how much is the government? How much should the government pay to keep you alive with some life-saving therapy? It could be a drug, it could be renal dialysis. That's the one that I used to use, because it was $50,000 a year. And to pay $50,000 a year, your life is worth $2.5 million, something like that, depending what the interest rate is. And to find out what a human life is worth, you can get everybody individually to actually do the calculation. And it relates to, if there was a 10% chance that you carried a fatal disease, which sometime in the next 10 years would expose you to the disease and you would die. And I could sell you an insurance policy for this super expensive drug, which if you were taking it would totally protect you from that fatal disease that you might have. How much each year would you pay in the insurance to make sure that you were going to be one of these 10% that died? And you can ask people, but this has been done in universities, and it usually works out, you will pay what your lifetime salary, you will insure for what your lifetime salary is, and you'll pay 10% per year of your income with that kind of risk. So I might have it slightly wrong at the moment, but you can find this kind of strategy and discussion in various journals and on the internet, etc. So it's a very good one to think about. So obviously the federal government in Australia would pay $50,000 a year to keep you on dialysis. It keeps you alive. Okay. What about if you needed a liver transplant and some kind of $100,000 one? Would they do it? Well, they would probably ration it, waiting lists or something like that, organ transplant. So as you go up the expense, then it becomes harder to get to that level. Because if the government spends $1 million on you, that's great, but I could get that same $1 million and put up a few safety warnings around the streets of New York City and save 5 pedestrians from getting killed every year. By spending that on road safety or something. So why would the government, it's pretty unethical for the government to spend $1 million saving your life when they could save 5 lives a year by spending that somewhere else. I mean, that'd be malpractice, really. And so then you get the situation, the true story in Canada, there's 2 counties in Toronto, and there was a little bus accident, and all the mothers got a bit frightened about their kids being on buses without seatbelts. And so both counties did the analysis of what it's going to cost. So there was a big campaign, save our kids, seatbelts on buses. So one county put seatbelts on the buses. So when you put seatbelts on buses, then you have to have cameras and you have to have some kind of enforcement to make sure all the kids are putting their seatbelts on. You have to have maintenance to fix the seatbelts all the time. So it costs them $6 million a year to have seatbelts on buses in that little county. In the other county, they said, we're going to keep the $6 million and keep our fingers crossed, because riding in a bus is the most safest thing that you have ever done in your life, practically. It gets publicity if you have an accident, but the cost to save a life if you're a driver of a car, and I put seatbelts, I only have to spend $25,000 worth of seatbelts, and I will save 1 year of life in drivers. But what about the passenger? Should I put a seatbelt there? Well, in fact, only 20% of the time is there a passenger sitting next to the driver. So if you're putting seatbelts on the passenger seat, it costs five times as much. It's costing you $100,000 per year of life saved to save the life of the passenger with the seatbelts. So it's a very borderline economic argument to spend $100,000 for seatbelts in cars on the passenger side. So okay, we'll do it. Okay. What about the back seat? That is empty 9 times out of 10 or 19 times out of 20 in my car, hardly anybody there. So therefore it will cost like $3 million to save 1 year of life with seatbelts in the back seat of my car. So therefore it's absolutely not a good economic argument to be having compulsory seatbelts in the back of cars. So after we had all that argument, I then said, oh yeah, but it's my grandchildren sitting in the back. Therefore, I don't care what the expense is. It's not too much. So you get this kind of finally paradoxical kind of discussion. But I think governments have to treat health just like everything else they do. You know, there's food, sanitation, roads, electricity, defence, and there's health, because it's all related to the well-being of the whole community, and that same thing. How much is a human life worth? And now you know.